Okay, morning grade 10. So you would have received an email from me regarding the marks that you got for the online Google quiz on the internal heart structure. Now I haven't written those marks down yet. Okay, I want to show you the results of that. And we all need to be getting a good mark there because you can't just learn the internal structure of the heart diagram and that's it. You've got to be able to answer questions that are a little bit more challenging. So for the cycle test or for the exam at the end of the year, please make sure that you know how to do this. And I want to set another little quiz, a similar one, but with different questions on Google Quiz again for next week. And then you all need to do it, please. Now, some of you haven't done it, the first one, and then I will choose the better mark that will go on to Adam as part of your assessment. All right, so let me show you the results of the quiz. So here it is. So 100 people answered. So there's about 10 of you that didn't answer. You can see here, let's try and make it bigger, that the average was nearly 13 out of 20. The range of marks was from 2 out of 20 to 20. Guys, you should not be getting lower than 14 at least for something like this. So you've got to practice this again. Okay, you need to watch this video, make sure you know what's going on. Go look at your notes on internal heart structure and be ready for the second Google quiz next week. Okay, please, people. This is not. I'm very worried about this very long tail at the end here. All right. The most common mark was 13. Well, it says here 13 out of 20. Guys, we need to push that up. All right, so I'm going to go through each question, and I've put the diagram here as well. So which side of the heart transports deoxygenated blood? You are looking at the heart in someone's chest as if you are standing in front of them. So this is the right side of the heart. That is the left side. The right side of the heart pumps deoxygenated blood. Okay, so 84% of you got that correct. Then at the bottom, next question. In the diagram above, which heart chamber is the right atrium? There, it's P. You should not be saying Q. That's the left side of the heart, but it's on the right of the page. It is P. The atrium is the top chamber. If you're saying R, people, that's ventricle. If you're saying S, come on, guys, that's basic heart structure. That is the ventricle. That's the left ventricle. Okay. Next one. In the diagram above, which heart chamber receives oxygenated blood from the lungs? So the oxygenated blood has to go into the left atrium. So the answer is Q. P receives deoxygenated blood from the body. Q receives oxygenated blood coming back from the lung. Please go watch the videos again. Go look at your notes. If you said R, no, people, that chamber is receiving deoxygenated blood from the atrium, not from the lungs. And if you're saying S, it's receiving oxygenated blood from the atrium, not from the lungs. Lungs is out here, the blood is coming into the lungs through vessels 9, and actually it's vessels 4 as well, because they bring oxygenated blood from the right lung, and 9 brings oxygenated blood from the left lung. But I only had 9 as a choice, okay, just to make it a bit easier. All right, next question. In the diagram above, which heart chamber contracts to pump blood to all parts of the body? The left ventricle, because the blood is going to leave through the aorta. Come on, guys, you should be getting this. Okay, then here in the diagram above, the blood vessels labeled 9 transport deoxygenated blood to the heart. True or false? No, it's false, because they're bringing oxygenated blood from the left lung to the left atrium. Right, next one. In the diagram above, the valves labeled 2 closed to prevent backflow of blood into the ventricles. Where are valves 2? There. Backflow of blood into the ventricle. Well, I should have maybe said right ventricle, but yes, that is true. Okay, if that valve closed, the semilunar valve at the bottom of the pulmonary artery, then the blood is forced through the pulmonary artery and it can't go back into the right ventricle. Next one. The blood vessel labeled 7 is the superior vena cava. Superior vena cava, 7, no. That's the inferior vena cava. 3 is the superior vena cava. I'm glad to see that most of you got that one right. Right. The part labeled 11 separates the atria from the ventricles. Okay, 11, that's the septum. That's actually going to separate the right side from the left side. So the answer is false. That was a trick question. I made it difficult purposely. I worded it differently. Right, now, which is the correct label, number, and name? Now, when you get a question like this, you get 1 mark only. Label, number, and name for the blood vessel which transports deoxygenated blood to the lungs. So it's going to be this blood vessel, pulmonary artery number 8, and it branches taking this branch here, taking deoxygenated blood to the left lung, and this branch on this side taking deoxygenated blood to the right lung. All right, so a lot of you got the correct answer, but please, the rest of you go and look why. Okay, next one. Which is the correct label, number, and name for the valve found between the left atrium and ventricle? Left atrium, left ventricle. That valve on the left, 2 left feet, bicuspid or mitral valve. All right. So what choices did I give? Number 10, bicuspid. Yes, it's number 10, bicuspid. 5 is not. 5 is the tricuspid valve. 2 is the, where is it now? Semilunar. They don't play a role here. 5 is not, wait, hang on. Yeah, so 5 is not, 5 is not the bicuspid, and the tricuspid 5 is not the correct answer. And 10, okay, is not a semilunar valve, okay? It's the bicuspid valve, so that's the correct answer. Okay. Arteries always transport blood away from the heart. It's true. I think you're thinking of that the pulmonary artery transports deoxygenated blood, but it's still away from the heart. Next one. Which statement is correct? The part labeled 6 there, those are those little tendinous cords. They hold structure 5 in place. Okay, now what? No, they prevent structure 5. If they're attached to the valve below, what can I use here? My phone. If those tendinous cords, my phone, are attached to the valve can only open down. It can't open up because they are pulling the valve down like that. Okay, so it prevents structure 5 from opening upwards. It's not a tendinous valve, it's a tendinous cord. They break and reform. Well, I just made that up. That's nonsense. Okay, next one. From the diagram, which heart chamber pumps blood towards the lungs? Towards the lungs means it's going to be deoxygenated. It needs to get rid of CO2. Towards the lungs. Chamber R, the right ventricle, toward left lung, toward right lung. Next one. From the diagram, which numbered vessels are the right pulmonary veins? Right pulmonary. From the lungs, pulmonary. Right, from the right lung. Oh, hang on. It's these one there. I nearly said there, but that's the pulmonary artery. I nearly got confused. It's number 4. And then they open into the left atrium, but at the back. Remember that diagram? All right, next one. From the diagram, which heart chamber receives blood from the brain? Upper part of your body. So it must be number 3. Oh, hang on. Which chamber? Okay, so it is the right atrium, and it would be through the superior vena cava. Come on, guys, let's get this one right. Next one. Okay, I don't need the diagram here. Veins always deoxygenated blood. False, because the pulmonary veins, these ones, transport oxygenated blood to the left atrium from the lungs. See, you got to read carefully. Okay, that's the end. So please go through this carefully. I'm going to make another one. I want you to do better. That's the better mark I want to put on Adam, but there's 10 of you that didn't do this one. Please make sure you do quiz number 2. Okay, thank you, people. And go learn the internal structure of the heart.